Hello, my name's Amy Brodtmann and I'm a neurologist in Melbourne who is the lucky recipient of a Heart Foundation Future Leader Fellowship for the second time. So I feel incredibly grateful to all of the supporters of the Heart Foundation for this fantastic award. My projects are really looking at vascular risk and how they affect brain health. And I suppose my research overall is how vascular disease can affect the brain. I'm interested in both the pathology, the bad things that happen, and also what behaviours make our brain healthier, so the neuroprotective things that we can do. Some of my projects over the next 4 years that are going to be captured in this grant include looking at how an irregular heart rhythm called atrial fibrillation affects our brain. We've known for years that it's a very strong risk factor for stroke, but now we know that it's also a strong risk factor for cognitive decline and dementia. We don't really understand why that is, whether or not it's because people have more strokes or whether it's because the same processes that are leading to the heart irregular rhythm are also causing changes in the brain. So as a first step, we're going to look in the Esprit study, which is a big study of people over the age of 75, to see whether or not people who have atrial fibrillation have different cognitive processing to people who don't. And that's going to be probably over the next year or so that I'll be looking at that. One of the big projects that the Heart Foundation has supported me in for a number of years, including in my prior work where we did some pilot data for this study, is looking at the brain benefits of exercise. We've known that exercise is good for your heart, it's good for your brain, it's good for your mood. But one of the things we're really interested in is whether or not it's good for your brain after stroke. People after stroke are often worried about exercising because they've just gone through rehab and they're concerned that they don't want to change their blood pressure. But we know that the fitter you are, the less chance you have of having a stroke or even another stroke if you've had one already. And we also know that the fitter you are, the less chance you have of having dementia. So what we're going to do is we're going to recruit a group of people after stroke. After they've finished rehab, we're going to exercise them for about 8 weeks. And we're going to actually look at their brains by looking at their brain scans to measure the different volumes of different parts of the brain. I want to answer the question, does exercise stop your brain from shrinking after stroke? And hopefully we can do that in this study. So thanks again to the Heart Foundation. This is just critical support in this difficult funding time. Thanks to the Heart Foundation board, to the scientific panel, and to all the donors who are supporting brain health, because I think it's really critical to realise heart health is brain health. Thank you again.